Let's talk briefly about amyotrophic lateral sclerosis, or ALS. Understand that it's also called Lou Gehrig's disease. When we talk about ALS, we focus on the axon. When we say axon, we're basically referring to the neuron. And remember, the axon is what connects the dendrites into the axon terminal in the neuron. And basically, the purpose of this axon is it helps transmit the nerve impulses throughout the body, right? Now, what occurs in ALS is basically the myelin sheath, which covers the axon, is being destroyed and basically replaced with scar tissue. Now, what occurs now is that the nerve impulses that goes through the axon is now distorted, or sometimes it could even be blocked. When this occurs, then the message that is being relayed within the neuron is not properly sent. Okay, now what occurs is that eventually the nerve cells will die and the muscle fibers within our body atrophies, and it basically results in a progressive motor dysfunction. And that's what ALS is. It's basically a progressive motor dysfunction that can lead to decreased motor function in the body. So basically, we can summarize this by saying that ALS is a deteriorating disease of the motor system in which the nerve cells or the neurons waste away or die, and basically cannot no longer send messages properly to the muscles, right? And this leads to muscle atrophy and eventually paralysis and death. So what do we see with these patients? Obviously, there's going to be a lot of muscle weakness, right? With the hands, with the feet, with the arms. The patient would also be fatigued, so we make sure that the patient gets plenty of rest. The patient would also have dysphagia, which is difficulty swallowing. So before we give the patient anything, we have to make sure that we assess the patient's ability to swallow, right? And also the patient's speech would sometimes be sluggish, right? And slow. It's called dysarthria. And with that, we can help the patient by assisting the patient in having an effective communication, such as using a board to write on or maybe having a speech therapy. So what do we have to know for the NCLEX? Basically, we have to know that ALS, there's no cure for ALS. And for patients, death can usually occur on average of 3 to 5 years, right? And in regards to medication, we would usually give a patient a sodium channel blocker such as riluzole. What riluzole does is it basically inactivates the sodium channel in the cell, which then helps decrease the cell degeneration, which in turn prolongs and extends survival time for patients with ALS. What are the side effects of riluzole? The patient could have nausea and vomiting, loss of appetite, dark urine. The stools could be clay colored, right? The patient could be jaundiced, some body aches, fevers, and chills. It is always very important to keep in mind that with patients with ALS, we need to conserve their energy by spacing activities throughout the day. And we also want to give the patient small, frequent feedings instead of a large meal. Thank you so much for checking out my videos. For more NCLEX stuff, please visit me at allnursingnotes.com. That's allnursingnotes.com. And don't forget to join the NCLEX 26 course, in which I will show you how you can productively and systematically study and pass the NCLEX within a 26-hour time span. Let's face it, studying for the NCLEX can be tedious, boring, and draining. The NCLEX 26 course is simple, straight to the point, linear way of studying that will help you pass the NCLEX. The course will also include the audio review, in which you can listen in your car or on your headphones and listen anywhere. Thank you and good luck.